Hi everyone, I'm here with John Burke from Anytime Fitness at Yonge and Elgin Mills. John is the owner and personal trainer manager there, and we've been doing a series of fitness tips for everyone to enjoy, and today we're continuing on in our series, and today's topic is HIIT, also known as high intensity interval training. So first, welcome John.
Yeah, thank you, Gord. Thank you so much for having me, guys.
Thank you for being here. And can you explain for the viewers what is HIIT?
Definitely. So HIIT is essentially high intensity interval training. So we brushed on interval training slightly last week. So high intensity interval training is essentially working with intervals at a higher heart rate threshold to achieve a slightly different result. Ultimately, with HIIT training, you're starting to work in the glycotic energy system, which essentially means using carbohydrates for fuel, as opposed to using an oxidative system where you're using fats for fuel.
Okay, so does that mean it's exclusive, this form of training, to cardio working out, or does it tie into resistance training? Can you clarity on that?
When you hear high intensity interval training, the majority of the time it's referred to in reference to cardiovascular training. But essentially with elevating the heart rate and bringing it back down over time periods, you could do that with resistance training as well. It just would mean that you would do basically time sets as opposed to like a certain rep scheme that you'd be trying to achieve. So you'd have timed rest and then timed work sets as well.
Okay, so if you have timed work sets and I'm using HIIT as part of my program overall, if I normally go on the treadmill, say I may go for 30 minutes and work with just sort of managing my heart rate and some standardized interval type training set. But now with HIIT, because we're upping the game more on the intensity, what happens to the work time? How should I manage it? So let's say if I at first did a half an hour on the treadmill, how would you suggest bringing that into use?
Well, with regards to the time frame that you would be doing your HIIT in relation to how you would do a normal cardio session, the nice thing about HIIT training and why a lot of people really like it is that you would do a lower amount of cardio per se. So, for instance, say you would do a 60-minute steady state session normally, HIIT training shouldn't be longer than 30 minutes. So if you're able to do longer than 30 minutes during high intensity interval training, the upper end intensity is not high enough. So typically a HIIT session will be anywhere between, say, 15 to 30 minutes. And the nice thing, like I say, is that with HIIT training, you can do a shorter time duration because in reality, you shouldn't be able to do longer than that 30-minute threshold.
Okay. So for me, who normally does 30 minutes on the treadmill, now I'm going to do HIIT, so I'm going to be probably cutting that in half, is what you're saying?
Yep.
For me to start with. And again, do you work to some form of exhaustion, or how do I know that I've set my intensity? My intensity is at the right level, so where does my heart rate have to go? So right now, for example, I push myself, I'm no longer focused on the fat loss, I'm in this glycotic burn approach, and I may peak at 150 plus. Mm-hmm. So with high intensity interval, where are you looking to raise that to?
Okay.
And is it different for everybody, kind of thing?
Yeah. I mean, with the HIIT training, in terms of the heart rate, it's going to vary from person to person. And for instance, say you do a 30-minute session at the moment, you're basically going to now do, say, a 20-minute session.
Okay. And
you're going to gauge your ability because in that 20 minutes with HIIT training, in theory, you really should be burning more calories than you would with that 30-minute of steady state.
Okay.
So typically you see about a 50% higher caloric burn return doing high-intensity interval training because of that higher threshold.
Okay.
With that being said, heart rates, like I say, will vary from person to person. So for instance, your max heart rate that you would push to might be 170, 180 at the absolute most.
And isn't that tied also to age? There's a recommended limit not to go beyond. So
yep.
Can you refresh us of what that how to manage that limit? Like,
yep.
So like I'm in my mid 50s, so what should my threshold be? What percent of my max heart rate, or where should I seek to push?
Part of it's going to be your age, and part of it's going to be your baseline heart rate, so your resting heart rate at the moment. Typically I get people to work within about 100% of their resting range. With that being said, like I say, it's dependent on, your heart rate because of your age and your current fitness level. So typically, like I say, like for someone like you, we would look at your resting heart rate, we look at your age. A couple other things would go also tie into that, and then from there we can then determine what your top end heart rate would be.
Okay.
With regards to HIIT though, heart rate is a major factor in it.
Right.
But what I always tell people is I want you to, at the top end of the interval, so basically your work interval, work at a high level. So don't worry too much about what your heart rate is at.
Okay.
What your threshold is, according to the math. Really, it's just about, for that 1 minute, say for instance you're doing 1 minute work, 1 minute rest, for that 1 minute, you want to be working as hard as you can for that 1 minute.
Okay. So one of the things I noticed that when I started to push the envelope for me to get my heart rate up into higher levels, I noticed that at first my recovery was very slow. So what should someone look for in recovery in that rest cycle of a minute of like how many beats dropping down, or how do you know you're not pushing it too hard such that you are recovering well enough to continue in a repetitive cycle? Like how, you know what I mean? I want to know that I'm not overdoing it and I'm done in like 6-7 minutes because I blew my heart rate up so high I'm gasping for air in the recovery.
I mean, basically you want to bring it back down to just above your resting heart rate, so maybe 20 beats above your resting heart rate. With that, basically you should feel comfortable. So you should bring it back down. You should catch your breath. You should feel like, your heart rate's calmed back down. You're starting to feel back to normal. And then you want to be going again. Basically, however long it takes you to recover is your optimal rest time.
Okay, so you mean like 20 to 30 beats above your resting heart rate is where you should be aiming to come back down to. So if you don't come back down quick enough, it means you're being too aggressive on the high end.
Exactly.
And if like in other words, if I go on there and I race myself up to 160 and, let's just say this rate where I should get down to is say 90 or 100, and it takes me 10 minutes to get there, then it means I just went too high on the max end. Right?
Exactly. And part of that too is that if you don't allow yourself to recover optimally, what will happen is when you then try to push it for the next interval, for that 1 minute span, you're not going to be able to achieve that. Right? Because you haven't
That's what
recovered.
I'm saying, then you're not really doing any intervals, you're just exhausting yourself.
So, we definitely want to see the optimal recovery. And with that being said, when you're looking at the space of the intervals, so a lot of people ask me, okay, so, well, John, should I do 1 minute, 1 minute? Should I do 1 minute, 2 minutes? Should I do 1 minute, 3 minutes? How should I gauge how long I'm resting for? What you want to think about doing is, at the beginning, give yourself about a 3-to-1 work to rest ratio. Okay? So if you're really pushing that top end for a minute, you want to rest about 3 minutes. And, from there, then you can start to cut it back. I personally really like a 1-to-1 ratio for clients.
Okay, you said work to rest 3-to-1. You mean 1 to 3?
1 to 3, exactly. So 1 minute of work with 3 minutes of rest.
And then work towards equalization over time as you get better.
And
because I think that's part of my challenge now, because I tried to do pushing the intervals and getting myself up to a higher level, and I'm realizing on the machine I set it's at equal intervals, and my recovery is not coming down enough, and then the next round, so my base recovery is just getting higher and higher, and so I think I need to have more rest time, and I'm going to factor that in next time.
Exactly.
So where does HIIT fit into an overall program? So if normally I was doing cardio 2-3 times a week, and now I'm going to do HIIT, does this mean I have less cardio time effort to do? And how does that fit in with the days, the program of doing resistance training in conjunction? So how would you adjust your program to up your game with HIIT?
I mean, like you say, the HIIT should be your cardio component. So usually what I always tell people to do is when you're starting off, you're doing a low intensity, steady state cardio method. Once you start to work HIIT in, you're definitely going to cut your overall cardio duration back, because at a higher intensity, you're not going to be able to train for quite as long. Right. So for instance, like I say, you might want to cut it back from 30 minutes to 20 minutes. So if you're currently doing, 90 minutes of cardio a week, you might now be doing 60 minutes of cardio a week.
Right.
The HIIT should always be separate from the resistance component, because although you're using similar energy systems, to resistance training, and you do have that afterburn that you would get from resistance training, where you're burning calories after you step off the treadmill, unlike steady state where it stops after you step off the treadmill.
Right.
You're not going to get the same effect on the musculature in terms of, strengthening the muscle, increasing the hypertrophy. That type of stuff isn't going to occur. So you're not going to be able to build muscle mass to get stronger doing interval training. You will increase the musculature endurance, but ultimately, whether you're doing HIIT training or whether you're doing steady state cardio, you're basically just trying to work the heart, work the lungs, and get a little bit of excess calorie burn with cardio, not necessarily working the muscle.
So your HIIT is the way to max out sort of your cardio burn, because you're doing it at a different level. So there is benefit. I remember you saying before that if I was just doing regular treadmill walking or jogging lightly and I wasn't pushing myself, that when you said when I get off the treadmill, it's sort of like the calorie burn's over. But if I understand, there's a little more benefit from high intensity training, that there is a metabolic burn that goes on longer beyond the workout. Is that right?
Exactly.
But not to the level of resistance like with weights. Right?
Exactly. So, for instance, if you do interval training and you burn 400 calories, or if you do steady state and you burn 400 calories, like I say, once you basically press that stop button on the treadmill during steady state,
right,
the calorie burn essentially stops.
Okay.
With interval training, there's been studies that show people burn about 50 to 100% additional calories after that cardio stops with interval training. So say you burn 400 calories, you're going to burn another 200 to 400 additional calories because of hormonal changes that occur during glycotic energy use.
Okay.
So there's much, much more benefit doing the interval training long term afterwards as well. So.
Okay. So how does HIIT fit into your program long term? So once I get the skill as a person to the level that I can actually work that, should I always be doing that for my cardio, like indefinitely, or it's just, vary it up, it's good not to be doing that intensity all the time? Or
I mean, I always...
What do you recommend?
I always like to do intervals just because it's a lot more time effective, like I say, and, there are a lot more benefits doing intervals versus steady state. With that being said, there are times that I will do steady state cardio. For instance, if I'm tired that day, because it does require a lot more energy and it's a lot more effort.
Yeah.
So, you might be tired. Like, for instance, I'll do, after, say, for instance, I train legs, I'll do steady state cardio just because I don't have that ability to push my legs to the brink, right? And it's always good to mix it in. I mean, with all the benefits of HIIT, there are still some benefits to doing steady state cardio that you won't get from doing interval training.
Okay.
So you always want to have a mix of things, right? You never want to just focus everything on one type of training. Just like you want to vary your resistance training, every 4 to 5 weeks, you also want to be varying your cardiovascular style training. Intervals definitely are the best bang for your buck, but it's always good to switch it up, not just for, the training benefits, but also it can get boring doing the same thing over and over again. Mm-hmm. So sometimes it's nice to switch it up, go for a jog, do some swimming at a steady state. You don't have to do the same thing over and over, because
and variety is more fun anyways, right?
Exactly.
I'm just saying. Okay, so if somebody, so I build that into my routine, and I'm getting my heart rate up, and right now where I'm at, I got to do what you just said, and that's try to work towards equalizing the intervals. But first, I have to get more rest time in, because I'm already in an escalation game that's really pushing me. So that was a very helpful. So I'm looking forward to that. So I don't consider myself at the level of being like really doing the high intensity level stuff, but I'm working towards that. But I did notice in doing the interval stuff, basically the last little while, I am gaining a little more strength.
Good.
And I've, things feel a little lighter. So, I'm getting there, and the weight comes off a little bit at a time.
Yep.
Okay, that's great. Well, thank you, John, for that great tip today. And next time we have something very interesting that you're going to be talking about, and it's called, the acronym is CASI, and it's a system. Do you just want to give a little intro to what that would be, so
definitely,
for everyone listening to know what to expect in our next?
So CASI is an acronym. It's KASSI. So essentially what CASI is a system that I have developed that ensures client and member success in any program or goal they're trying to accomplish. So yeah, just like Gord says, that's something we're going to be talking about a little bit more next video. I'm going to go into depth in each of the components and how you can optimize each of those components to make sure you're successful, not just potentially be successful. So.
Okay, that's excellent. Okay, so thank you very much, John, and everyone, we're going to continue providing these interesting tips on fitness and health, and if you haven't subscribed already to our channel, please do. We're going to keep producing some interesting videos to share and help you with your fitness and health goals. And thank you for watching, and if you have any questions or comments, please share below, and we'd love to respond and share. And thank you again.